must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. My name is Brandon Powen, and I am one of your co-hosts. And of course, as always, I'm joined by my fellow co-host, F. Scott Field. Today, we welcome a very special guest from across the pond. And no, that's not the UK. We actually have a very, very special guest from South Africa. As today, we are very, very humbled to welcome Dr. Tim Noakes. Now, for those of you who don't know who Dr. Tim Noakes is, he is a South African scientist and an emeritus professor in the Division of Exercise Science and Sports Medicine at the University of Cape Town. He is also a member of the National Research Foundation of South Africa, who listed him as one of their highest rated members. After coming across research which denounced current international dietary guidelines as fallacy, Professor Noakes started researching the effects of carbohydrates, proteins, and fats on the human race. And after his research convinced him that a high-fat, low-carb diet is the healthiest option for many, Dr. Noakes founded the Noakes Foundation in 2012. He has also stayed very active, as he has run more than 70 marathons and ultramarathons, and is the author of several books on exercise and diet. And he is known for his support of a low carbohydrate, high fat, as he set out in his books The Real Meal Revolution and Lore of Nutrition, Challenging Conventional Dietary Beliefs. And I'd also like to give a good shout out to Andrew Rothschild for recommending Dr. Noakes for this episode. And Tim, thank you so much for your service with everything you've accomplished, as you've truly been a catalyst for change. You know, with our audience consisting of different healthcare providers and educators who perhaps have not heard of you, would you mind telling our listeners just a little bit of some background about your educational journey and how this journey started from really looking at the low carbohydrate and high fat diet kind of things?
Sure, Brandon. Thank you very much for inviting me onto your program. So my career begins in 1969. I go and study medicine, and I didn't really know what I wanted to study when I left high school. Fortunately, I had a gap year in America, and there I decided medicine was I was going to study medicine. That was largely because Chris Barnard performed the first human heart transplant in South Africa in Cape Town at my own university, and I decided, well, if he could do that, then maybe that's a nice thing to study. And so I studied medicine and went through my internship and realized that my interest was not in treating disease, it was promoting health. And I went straight from there into research, and then started teaching sports science and sports medicine in South Africa. And of course, I was doing all this running, which you heard about. And then I thought that high carbohydrate diets were ideal, because that was what we were taught. We were taught that high-fat diets will kill you and high carbohydrate diets are very healthy. And I was funded by industry, and so we did lots of research, groundbreaking research on carbohydrates and exercise. And all this time, I was eating a high-carbohydrate diet for 33 years, it turns out. And then in my 33rd year, I discovered that I wasn't so healthy. And by chance, I heard of Jeff Volek's work and Steve Finney's work, and read the book, The New Atkins for the New You. I read it for a couple of hours, and then I said, oh my gosh, I got it wrong. For 33 years, I got it completely wrong. And so I decided to change my diet that day and to cut carbohydrates, and had a great success on it. And then started reading and researching it, and realized that I'd completely misled people. I'd written this book, Law of Running, which promoted the use of a high carbohydrate diet. And I realized I was completely wrong. So I had to change, because I knew that I was harming people. Anyone who'd read the Law of Running and who was insulin resistant and is eating the high carbohydrate diet they were going to be in trouble. And so I said, I'm sorry, I made an error, I need to change it. We then wrote the book Real Meal Revolution, and that really caused huge problems in South Africa because it completely changed the way people thought about nutrition in South Africa. And there was a huge backlash against it. And I then eventually was charged with unprofessional conduct, and I went through a 4.5-year trial for my professional conduct. And so that was a problem. But eventually, after 4.5 years, we won, and I'm now in the clear. And we wrote the book Law of Nutrition, which explains everything about that. So I'm glad that I saved my own life. It turns out I developed type 2 diabetes. I'm now in remission on this diet. And as long as I keep my carbohydrates low, I'm fine. Yeah.
Wow, Tim, that is an amazing story and quite the journey. A lot of ups and downs there for sure. But, obviously being from the U.S., having interviewed a couple of medical professionals on our show, we kind of got a grasp of what med school looks like here in the U.S., but I'm curious if you could give us a little background on what medical education looks like in South Africa.
So in South Africa, we don't go through a pre-training, an undergraduate training, and then go to medical school. Here we go straight to medical school, which is a bit of a disadvantage, so that we're taking people of 17 and 18 who really don't understand what medicine's all about, and they go straight into medical school, and there's no other option. Once they go through that training, that's medicine is what they have to do. So we do the first year would be a standard physiology, and a standard year of physics and chemistry and zoology and a few other things. And then we go straight into anatomy and physiology. And then in the third year, you'd be in the hospital and you'd see patients and be doing other things as well. And at the end of 6 years, you get your degree, and then you have to do an internship in the hospital for a year. I think it's a year, might even be 2 years now. So that's the way. So then you're allowed to go and practice medicine as a general practitioner. And of course, if you wanted to be specialized, then you have to come back in and do your specialist training. So I think that in the end, the result is pretty similar to the United States training, but initially we don't have the broader training in other fields that a medical student in the United States would have. And as I've said, in a sense, you specialize right out of high school. You go straight out of high school and you're going to become a doctor. And I don't think that that's the ideal way of doing it.
Interesting. Actually, that was kind of a follow-up that I just had to that. I mean, with that pre-path being so different, again, like you said, kind of just jumping right in, what are your thoughts on that method of kind of just diving right in? Like, are there any risks of early specialization that we risk, or what are your thoughts on that?
No, I think it's a huge risk. I think the American model is much better. I also think that everyone should go through the same training. In other words, if you're going to be a physiotherapist or a physical therapist, or we call them biokineticists, that's people who use physical fitness to improve health. Whatever your training is, and we mentioned physiotherapy, I think doctors, all of them should get the same training, and then you can specialize thereafter and choose. Because literally, you don't understand what medicine's all about when you're 17 or 18. You have not the faintest clue. And what happens in this country, and I don't think it happens in the US to the same extent, but people are very clever, and they think, well, what's the biggest challenge? Medicine. To get into medical school is a challenge here. I mean, it's impossible to get into medical schools as in your country. So that becomes a challenge. And then, my ego is satisfied, I got into medicine. And then all of a sudden you realize, actually, you don't need all this intelligence to be a doctor. That's the problem. What you're dealing with on a day-to-day basis doesn't need the intelligence that you brought into the profession. And so I think it's a big problem. I think that there should be a more generic training initially, and then thereafter you specialize in whatever areas you really find interesting.
I think that's really fascinating, actually, because just kind of hearing the differences between the U.S. and South African models. Tim, I want to back up a little bit, because when you had said that you had kind of read that book initially, and then you started to kind of prompted your research into carbohydrates and fats and kind of its effect on the body. I'm curious, because evidence is always evolving, and I'm really curious as to what does the evidence, of course, as we know now, I realize this could be totally different in a few months from now, but what does it say about the effects of carbohydrates, fats, and proteins on humans? And what do we still not know about this?
Well, what we do know is 1 million years ago, we were carnivorous, and we were almost 100% carnivorous. And how do we know that? Because the animals that were alive 1 million years ago were 3 times the size of the large animals we have today. So the elephants were 3 times the size of elephants that we have today. And the rhinoceros, the hippopotamus, and so on. And we wiped them out because we had to eat their fat. There are many reasons why you had to get the fat. So, and we wiped them out. Over 1 million years, we've reduced them to what we have today, tiny animals by comparison. So we were just eating fat and protein 1 million years ago. And then 18,000 years ago or so, we introduced cereals and grains. And now, and the plant-based diet is what we're moving towards. And as we move more and more towards a plant-based diet, we become more obese and more diabetic. So my understanding, and I think all the evidence is very clear, is humans are designed with a long, small bowel and a short, large bowel. A long, small bowel for digesting protein and fat from animals, and a large bowel because we don't digest cellulose very well. We have to have bacteria to do it, and we've only left a little bit of space for those bacteria. But we come from gorillas and chimpanzees who have an enormous colon with full of bacteria because that's what they convert. They convert cellulose into saturated fats. And that's the key point, that they take a carbohydrate and convert it into saturated fats. So our body is designed to metabolize fats, not to have carbohydrates instantly available from the small bowel into the portal circulation and into the liver. That's what's killing us. It's this every few hours, this load of carbohydrate. We're just simply not designed for it. So we hypersecrete insulin and we become insulin resistant, and then insulin causes all these other conditions, the obesity, the diabetes, etc., the cancers, the dementias. And so we designed historically to eat fat and protein. We can eat a bit of carbohydrate, but once I think it gets above 30, 35%, that's when you start to see the problems developing.
Interesting. And Tim, so what are the things that, obviously you had mentioned kind of what we know, what are some things that are currently being researched and kind of some of the big research questions regarding this that we still need answered?
Well, I think my favorite company in the United States is Virta Health Company from San Francisco, because they've shown that you can use telemedicine to reverse diabetes, because the guy who started it, Sami Inkinen, is a genius. And he said, diabetes is a disease of choice. You make the wrong choices every minute of the day. And to correct that, we have to be with you for 6 months or a year until you learn to make the right choices. And so that's the future of medicine. It's behavior change. And it's not going to be provided by doctors sitting one-on-one with a patient. It's going to be provided by some other source. And I'm not sure quite where it's going, but the reality is that the internet is providing all the information anyone needs to keep healthy. They just have to get it and sift it and then go to the doctor and say, doctor, here I read this book and it says I needed my vitamin D measured. Please measure my vitamin D. And then the doctor's going to have to say, well, okay, that's fine. And then he's going to have to know just as much as the patient knows. And that's going to be tough. That's going to be tough because the public are going to become specialists in their condition. And unless the doctor is at least as equally well versed in that condition, they're going to go somewhere else. So that's the future. So what don't we know? What we know now is a high carbohydrate diet causes diabetes and obesity. And a low carbohydrate diet below 25 grams can reverse diabetes, put it into remission. That's the first disease we now know that you can't treat it with drugs. You can't just shoot up the insulin and hope that it's going to help you. It's not. The next ones are going to be autoimmune diseases. And you watch. This is a prediction I can make. Autoimmune disease is going to be linked to plants. It's a plant-based disease, and it's caused by whatever's in plants. In these individuals who get the autoimmune diseases, it causes a leaky gut, and then bacterial proteins enter the circulation. The person produces an immune response to that protein, and they get the autoimmune disease. And so that's going to be the next one that's going to come through. But then we're going to look at cancers and dementias. Those are all going to become under the control because we're going to learn that they're nutritionally based diseases.
That's interesting, Tim. One brief follow-up just to that. That's fascinating when you talk about the autoimmune. Are there specific plants that are kind of being looked at that are kind of they're thinking cause that? Like, because just to get some clarification on what kind of plants are they looking at that they're theorizing, again, at least theorizing right now that might have a relationship with?
I don't think we know. All we know is that plants are designed to produce things to make humans not eat them. And that's the key. That the lovely story is animals are difficult to kill but easy to digest. Plants are easy to kill but difficult to digest. And I think that's the key is that people with autoimmune disease are reporting once they cut all plants, but it has to be 100%. They're then finding cures for their autoimmune diseases. So again, it's not everyone, but there are some. And that's enough to say that we need to investigate that. I think that the cancer therapy and cancer prevention is going to be linked. Cancer is going to be linked to insulin resistance, high carbohydrate diets. And it's not going to be a cure. It's not going to be that the low carb diet is going to cure cancers. But there will be individuals for whom, yes, it will cure cancers. But it will indicate that there are other things we should be studying to look at. And the other one I would argue is in heart disease, it's not cholesterol that's causing heart disease. And there we have to go and look for other mechanisms. And that's the problem over the last 30 years, because industry is controlling the medical profession. The other possibility is not considered. So the possibility that diabetes is the biggest cause of heart disease and carbohydrates are linked to diabetes is just forgotten. No, it's cholesterol. We know it's not cholesterol. It's something else that's causing heart disease.
Yeah, Tim, I don't even think we're breaching the surface, because I know a lot of studies recently are showing stress and sleep are huge factors with heart disease. So I think, those are two avenues we're going to have to go down as well. But, we like to play devil's advocate a little bit on the show. And if you wouldn't mind, I'd love to hear some of the research limitations that are out there currently regarding low carbohydrate research that has been published.
Yeah, the problem with the low carbohydrates, of course, is that there's no money to fund these researchers because industry is trying to prevent the studies, not encourage them. The other problem we always have is, oh, yes, but where are the long-term studies? Well, the answer to that is there aren't, except that 1 million years ago, we know what we were eating. And we were eating a high-fat, high-protein, low-carbohydrate diet. And we survived, and we were pretty healthy. But people will say, oh, yes, your longevity was short, and so on and so forth. But what we do know was that in the English population, the British population in the mid-Victorian period between 1830 and 1870 were the healthiest. They had the same life expectancy as we have today. And they were not eating the highly processed diets that are popular today. They were eating food coming directly from the farm. It was cheap and everyone could afford it. And they didn't have heart disease. They didn't have cancer. They died of infections and injuries, but not of heart disease and cancer or autoimmune disease, by the way. So if you look at the historical basis, it looks like the low carb diet's doing pretty well. And then when we introduced the low fat diet, then we started to develop problems. So the one problem is we don't have any long-term studies, but we don't have long-term studies on the high carbohydrate diet that have gone beyond 8 years. And those studies that have gone 8 years show that it doesn't help. It doesn't make any difference. If you cut your saturated fat and your fat, you don't live any longer. You don't have less heart disease. You don't have less diabetes. So people are asking us to provide evidence, yet they continue to promote a diet for which there is absolutely no evidence. And then the third problem is industry at the moment is pushing a plant-based diet, and so is the World Health Organization. So there's this action against meat as a source of protein and for healthy living. And it is globally organized. And the recent studies from Harvard suggesting that low carbohydrate diets are associated with increased mortality is absolutely the worst piece of science I've ever seen. And that it could come out of Harvard shows that there's a real problem with the epidemiological research coming out of Harvard. But just to come back to that, we do know now that the epidemiological research in nutrition is the worst science there is. That nutrition science is one of the weakest disciplines in science that there is. And people like John Ioannidis from Stanford University, professor of medicine at Stanford University, wrote a publication in the JAMA about 3 weeks ago, and it's ridiculous that we have to get rid of all this nutrition science because it's simply wrong. So we really have to redo all of our nutrition science and understand that the basis of our teaching is not based on hard science.
That's really interesting to really gather that, there's not a lot of long-term data. I want to back up a little bit to your beginning here, Tim, a little bit, because you had mentioned that, when you started implementing some of this, you got a lot of pushback. So, and it's been interesting because you kind of been both like a lightning rod and a seemingly professional smear target at times. What makes this upstream swim worth it?
Yeah, well, you see, the error they made a couple of errors, but the one was that I spent 45 years in sports science and sports medicine and became an A1 rated scientist. And they tried to destroy my entire career. They tried to say, this guy's a quack now. he's got onto this bandwagon. There's no science behind it. It's all anecdote. It's his own experiences. There's no science behind it. And then they charged me with unprofessional conduct. And so I had a choice. I could have resigned as a medical doctor and said, okay, I don't want to go through this. I'll just resign, and you can't charge me if I'm not a doctor. And I decided there's absolutely no way I was going to do that, because the end result was, but people would say, yes, but you see, he became a quack. He might have been a good scientist once upon a time, but he became a quack. And so my wife and I decided we're going to fight this with everything we have. And we did do that. And in the end, it was really worth it because we got to speak for 4.5 years. But we got to speak in court. It was 28 days in court. I gave evidence for 12 days. 12 days. I was cross-examined for 3.5 days, and they couldn't find error in anything I said. And it's now it's everywhere on if you go to the Noakes Foundation, you can see all the information that I personally presented and our 3 expert witnesses. And so we proved that the low carbohydrate diet, there is science behind it. It's not unconventional. It is fully supported, and it seems to be a better solution than what we've got. So in the end, my wife said to me about 3 months ago, she said, Tim, I think it was worth it. In the long term, it was worth it. But I can promise you, 2 or 3 years ago, it was hell. It was not nice. And still we carry the scars. When your university evicts you, that's what they did to me. They evicted me. They just threw me out. They threw me to the wolves. And despite the fact that, as I said, for 45 years, I worked there and built up some renown in sports science. And to get thrown out just shows, that was tough.
Yeah, well, Tim, we certainly appreciate you fighting the good fight, man. It's never easy. But what would you say are some situations that a low carbohydrate, high fat nutrition diet may not be appropriate for an individual?
Yeah, there are some people who, when they eat a high fat diet, their triglycerides go shooting up. And I forget the name of the condition, but it's an unusual condition, and it's a genetic disorder, and it's uncommon. And those people, we wouldn't think that having a high triglycerides would be beneficial. So when we go put you on a high fat diet, we don't want to see the triglycerides come shooting down, and the HDL rising, and glucose and insulin coming down, and HbA1c coming down. And those are what we would say is a good response. If you don't show that response, the one difference is that triglycerides go up. If your total cholesterol goes up, we don't worry about that, because I think that because we believe that it's not the LDL that increases is the larger particles, LDL particles, and they're not considered to be toxic. And the key is you want to get your diabetes, reverse your diabetes, and reverse your insulin resistance, or control your insulin resistance. Those are the key variables. Other than that, I don't really know of any absolute contraindications to the diet.
That's interesting. And Tim, since we have a lot of healthcare providers listening, of course, from many different aspects, not from just physicians, rehab professionals, nurses, apart from what you've mentioned, what would you say are the biggest nutrition take-homes that you think all healthcare providers should be aware of when it comes to nutrition?
Okay, I'll summarize it very simply. And what I've learned over the last 7 years since I've been on this diet is that the most common medical condition across the globe, United States of America, South Africa, Europe, the Pan-Pacific countries, the Pacific Islanders, it's insulin resistance. That's the number one condition. Yet we don't teach it. At my medical school, we don't teach it. It's like it doesn't exist. And obviously why is not taught, because it conflicts with the diet heart hypothesis that fat's what causes ill health. So in my opinion, insulin resistance is a syndrome which, when you expose it to a high carbohydrate diet, produces a range of disorders which have to happen. These have to happen if you eat a high carbohydrate diet for long enough. And that is, you will become obese, you'll become hypertensive, you'll develop type 2 diabetes, you'll develop heart disease, you'll develop cancer, and I suspect dementia as well. And that the cancer and dementia link is not as clear as the other 4. So those are the chronic diseases that are destroying medicine. So therefore, they're all linked to insulin resistance. So the problem is not cancer, it's not heart disease, it's not diabetes, it's insulin resistance. And we have to teach that. So I believe that 85% of all chronic disease, which we call disease of lifestyle, is disease of nutrition. And you reverse it by reducing the carbohydrate intake in the diet. So all of medicine in the chronic disease phase comes down to insulin resistance. So that's what you have to understand, and that's what you have to treat. And the way you treat it is behavior modification. It's not through pills. And the reason this kickback on me is because I'm saying, guys, the world is changing. You can't keep medicating an illness for which the medication is not the cure. The cure is remove the carbohydrates. And that's why there's pushback. But you see, the internet and social media are educating the broad public. There's now democracy. And they're going to realize this is what I'm saying is true. And they're not going to go to conventional medical services for any longer once they realize, actually, I can do it myself. I just have to eat a different diet.
Yeah, Tim, kind of a follow-up on that and a bit of a selfish question, as my wife is a type 1 diabetic. How does this diet work for type 1 diabetics? Relatively effective?
Brilliant. No, it's the only diet for type 1 diabetes. You see, if you go back to the 1920s, before the discovery of insulin, this was the diet that was proposed. People knew that the only way you could keep a type 1 diabetic alive was to starve them, but also to eat no carbohydrates. And that would prolong their lives. And they were hanging on for insulin to be discovered. Insulin is discovered, it's injected, and all of a sudden they think they've got the absolute cure for type 1 diabetes. Only problem is they start injecting the insulin, and then they start allowing carbohydrate intake to increase. So whereas before the diets were restricted to 25 grams of carbohydrate a day maximum, by the 1950s or 60s, type 1 diabetes were eating 250, 300, 400 grams of carbohydrate, and they were using insulin to drop the glucose. And that's not the way to do it, because we now know the more insulin you inject, the quicker you become more insulin resistant. If you're type 1 diabetic, you become insulin resistant, i.e. you develop type 2 diabetes on top of your type 1 diabetes, and you live 10 years shorter than people who do not have type 1 diabetes. So the key is that glucose or carbohydrates raise your glucose, and then you have to inject insulin to lower it. And there is no real science telling you exactly how much insulin you must inject, because the absorption is always different. So every so often you get a hypoglycemic response, which is catastrophic. As you know, it's really difficult. And it's only because a person has taken too much carbohydrate and then injected too much insulin, and they get a hypo. And then what happens, you've got to now take more carbohydrates, so you go back on this swings and roundabouts. The only way to prevent that is to not eat carbohydrates in the first place and to minimize the amount of insulin you need. And the number of people who write to me or who are on Twitter saying, oh my gosh, type 1 diabetes is relatively easy to manage if you can keep your carbohydrates below 25 grams a day.
I love it. I love it, Tim. That's great information. What have you found to be the most effective methods or strategies of reaching and teaching the public when it comes to promoting best nutrition?
Yeah, that's a brilliant question, Scott, because, what happened, we wrote the book Real Meal Revolution, which revolutionized the understanding of nutrition in South Africa, because we said, here's insulin resistance, this is what it causes, you've got to eat a low carbohydrate diet, here's the recipes, brilliant recipes, if you eat these recipes, you'll lose weight and you'll become healthy. And that really converted many, many South Africans. For example, there's a Facebook page in my town, in Cape Town, which has 1.4 million subscribers. It's astonishing. And it's a ranting or low carbohydrate Facebook page. And these are people who have picked up the idea. And now they're getting information from each other. They're educating themselves. So my view always was that we were going to educate the public. One meal at a time, we were going to reverse this. And I think that still remains. What we've since learned is that the key players in this are the doctors. They're absolutely critical. The nurses and the doctors. They're the people who can change thousands of people every year. And so now we've started teaching the doctors, and we have a nutrition network on the Noakes Foundation. That's what we teach now, and we're focusing on that because we think educating the doctors is the next big change. Because what's happening, the patients are coming to the doctors and saying, Doc, I'm on a low carbohydrate diet. Will you help me? And the doctors are realizing that there's really something in this. And so they really need to be able to help their patients. So initially, we focused on the patients. Getting the public to understand a low carbohydrate diet is the treatment for insulin resistance and type 2 diabetes and obesity and hypertension. And now we've realized, fine, we've done very well there. Now we've got to target the doctors as well.
I think getting all those stakeholders, including, the patients, and now working more into physicians, because obviously you help one physician learn that, how many patients are going to be helped from just one physician. It's huge, and it just makes sense. And I'm curious, from your standpoint, what would need to happen to make that next level change so that medical schools kind of started teaching that as the norm? So what are your thoughts on that?
I'm not sure how it's ever going to happen, because medical schools in this country, and I suspect the United States, are controlled by the pharmaceutical industry. And they will not allow this to be taught, because it takes away from their model, which is the disease is all separate diseases caused by, we don't know what causes cancer. We don't know what causes hypertension. We call it essential hypertension because we don't have a clue. Well, just cut out the sugar and see what happens to your essential hypertension, which is what I would love people to do. But so that they're going to stop that, because that's the way they control the professors of medicine, they control the professors of cardiology, etc., the endocrinologists. So it's going to have to take something very, very dramatic to change that. And I think the bankruptcy of the medical services is going to be what it is. We can't afford to have so much diabetes. And eventually that reality is going to strike, and people are going to realize that the pharmaceutical industry has benefited and our health has not benefited. And so that's what's going to have to happen. And then there's going to be this revolution, and we will teach nutrition as the key driver of chronic disease. And but how's it going to happen? I see in South Africa what's happening is that the public sector, i.e. the government funded, will continue to teach the old story that it's high-fat diets are dangerous, etc., and you've got to eat our pills. And the private sector will increasingly become, actually, no, nutrition is a key driver. And the patients will get healed. And if you don't heal the patient, you won't be able to practice. So I see this dichotomy arising. And eventually the public sector will have to realize that we've got to do the same.
Yeah, Tim, knowing that the Noakes Foundation supports and funds independent research on low carbohydrate information, I'm curious to find out what barriers that independent researchers face when trying to conduct and publish independent nutritional research.
Yeah, that's a great question. I think that it's not as bad as it was. In other words, so you read my book, Waterlogged, and you will see when I took on the sports drink industry, there were only 2 journals in the world where I could publish work, because it conflicted with what the editors of the journals were funded, because they were funded by industry to make sure that carbohydrates are important and sports drinks are important. And so when you send a paper to these journals, they would send it to colleagues who did not agree with me, and they would reject the papers. Always they would say exactly the same things. So I knew exactly who was reviewing them. But there were 2 journals in the world which were independent and could publish the work. I think that there is a growing independence of the journals, and that it is possible to get your work on low carbohydrates published, low carbohydrate research published. I don't think there's the resistance that there once was. And there's still too little money to fund these studies, but increasingly as I've said, increasing the research is being done, it is being published in good journals, and eventually it'll prove the breakthrough eventually. The British Medical Journal is in real trouble the British Journal of Sports Medicine has been published quite a lot of nutrition lately, and there's a whole furor because they published a lot of our papers and things, and people are saying they're biased towards the low carbohydrate diets, which is not true. They just publish good science. That's what they do. So again, the British Medical Journal is publishing research on both sides, but they are at least publishing stuff on low carbohydrates, and the British Journal of Sports Medicine. So no, there is. And no, let's be fair. The Journal of American Medical Association has published some really important papers on low carbohydrates. So I don't think maybe not. I don't think there's been too much in the New England Journal yet, but maybe they will. The trouble is, New England Journal is tied right to Harvard, and Harvard is just so pro the plant-based diet that's one of the problems.
That's really, really interesting. And Tim, it's been actually a very, very interesting discussion because, we normally like to ask this final question to all of our guests, but of course our podcast is called the Healthcare Education Transformation Podcast. And so the question that we ask is, if you could change one aspect of healthcare education, whether that be medicine, rehab, or other healthcare provider related, which aspect would you change and how would you change it?
Well, firstly, I would say chronic disease of lifestyle are not chronic disease of lifestyle, they're chronic disease of nutrition. And that nutrition accounts for 85% of chronic disease. And you have to understand that. And so the whole thing we talked about this afternoon is that you've got to move away from this idea that we don't know what causes hypertension. Cholesterol causes heart disease. No, it doesn't. That there's insulin resistance is the driver, and it's the carbohydrates that are driving the insulin resistance to cause these diseases. So you've got a normal physiology, which is insulin resistance. Humans evolved insulin resistance for reasons that I'm not sure we fully understand quite yet, but it had to have biological value because that's why it's so widespread across the globe in so many different ethnic groups, across different races, population groups, etc., across the world. Insulin resistance is the prevalent condition. So it has to be genetically valuable. And when you expose insulin resistance to high carbohydrate diets, that's when the problems arise. So we've got to learn that and teach that. And once we do that, we'll cut our medical costs down and we'll start curing people. You know, one of the joys I have is when I travel the world and I talk about this topic and I have young doctors come up to me afterwards and they embrace me and they say, Professor Noakes, you changed my life because I can help patients. I now feel that there's something valuable in medicine. I just don't sit there and dish out pills. I help people get better, and I see it every day. And that makes my life worthwhile, and thank you. And if we can just get that message out to young doctors, then we've done something really important.
Yeah, Tim, that's just such powerful stuff. And, you know, I can't thank you enough for your time and for coming on the show today. But where can people reach out to you and find you online if they have follow-up questions or, want to find out more information about low carbohydrate and high-fat diet?
Sure. Thanks, Scott. They could go to the Noakes Foundation, and anything that you want to write to me, you can write through the Noakes Foundation. I'm very active on Twitter, and my code name is @Prof Tim Noakes. That's @Prof Tim Noakes. And you're welcome to follow me on Twitter, and you'll see that every day I tweet new studies and give opinions, my own opinions about nutrition and medical education, and frequently about sport. But those would be the two, the Noakes Foundation and my Twitter feed @Prof Tim Noakes.
Well, perfect, Tim. Well, again, thank you so much for your service, your dedication throughout your whole journey to really fight for really what you believe in and for the science, for everything. And thank you for coming on today to speak with our audience. I think I definitely echo Scott's comments. Now we know some stuff. Now it's a matter of let's all take some action to contribute. So thank you again so much for everything.
My pleasure. Thank you, Brandon, and thank you, Scott. Lovely to chat to you, and very best wishes for your futures.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.